Hello, and welcome to the launch of our video on strengthening family planning services for Guatemala's Indigenous people. This is the third video in a series developed by the Health Policy Plus project on why investing in the policy environment makes a difference for helping countries achieve their health goals while helping people achieve better health outcomes. People often focus on service delivery without realizing that behind those services are many crucial elements, starting with a solid policy environment that includes resource mobilization, governance structures, supply chain, to mention only a few of the inputs into ensuring that services can be provided. Previous videos in this series on why policy matters have examined large-scale policy experiences in Kenya and Nigeria. Today, we focus on Guatemala and its investment in developing the National Contraceptive Security Commission, and more recently, Contraceptive Security Subcommittees. These are governance structures at the national and department levels. And these bodies help ensure that women have access to quality family planning services while fostering a stronger working relationship between government and civil society. And as we'll see, the model is contributing to better collaboration among stakeholders, better access to services, and better health outcomes. I want to thank USAID, which has provided support for all aspects of the Health Policy Plus project. USAID Guatemala, working through HEP Plus, has supported the development and functioning of the CNAA and its subcommittees, and USAID Washington has provided funds that allow us to develop this video that documents this important policy story. We'll start by watching the video, and then Herminia Reyes, HEP Plus Country Director, will facilitate a panel discussion. Thanks.
Good morning, everybody. I'm Herminia Reyes Aguilar. I am Director of HEP Plus for the country. I'd like to thank everybody for being here today. The video we have just seen let us know that the population in Guatemala and the access for family planning services can be difficult in spite of all the problems we have. This is specific true in some indigenous populations, many of which live in rural communities in the Western Highlands, as you could see in the video, while 60% of the women who are non-Indigenous that use modern contraceptive, less than 40% of Indigenous women can do it. However, the National Contraceptive Security Commission and the different subcommittees are helping us improve the quality and access to services and products for family planning. In this webinar, we have the presence of very significant personalities of the country that throughout the history and the promotion and advocacy of family planning have been a key here. We have Dr. Ima Far, Karen Morales, Marta Julia Ruiz, and Dr. Salvador Rivera. Dr. Ima Alfaro is a physician and surgeon specialist in project management. You can see her from the Office of Health and Education of USAID. She has wide experience and strong commitment in reproductive health, family planning, and HIV, including all the processes for contraceptive security. Marta Julia Ruiz, who is a physician with studies in public health, also has a lot of experience as regards gender, community mobilization, training for young women, and is part of the observatory OSAR, on sexual and reproductive health, which is a civil organization and supports different projects related to health, reproductive health rights. And she is also improving and monitoring different health services aimed at different adolescents. Dr. Salvador Rivera is a teacher. He has been a teacher for 10 years. He works with the Ministry of Public Health and Social Welfare and also in SIGSA. And he is currently in charge of the logistics of medication in Quiche. And also Dr. Karen Morales, that is next to me, physician and surgeon with a master in gynecology and obstetrics. And she has been working for 8 years in the Ministry of Public Health as in charge of the component of family planning. Since then, she has participated as a member of the National Contraceptive Security Commission, CNA, and she coordinates all the activities at the central level with representatives of the institutions that are part of the commission. To all our panel members, welcome. Thank you for all the effort you have made supporting the promotion of family planning in Guatemala. In order to begin this panel, we have prepared a series of questions I would like to address to all our panel members according to the experience. So the first question is going to be directed to Dr. Imafa Alfaro. The statistics show that the use of contraception is much lower among indigenous women than among non-indigenous women. Can you help us understand why? You have the floor. Thank you very much and good morning, everybody. Thank you for inviting me to be part of this panel and thank you for the question you have made this morning. According to the most recent census, 43% of population in Guatemala is Mayan, with less percentage of other indigenous people. 65% of indigenous people live in the rural area of Guatemala, and more indigenous families than non-indigenous families live in poverty conditions. The mean age of completed schooling is 3.9 in indigenous people versus 6 years in non-indigenous women. The gap in the use of contraceptive methods among non-indigenous and indigenous women still exists, but we have to recognize that the use of family planning has increased in the last years. And the gaps are related to factors related to supply and demand. As regards the demand, I would like to refer to some elements that explain the difference between indigenous and non-indigenous women in the population in general, but more in indigenous population. There are several myths and inexact information about the effect of methods in the health of women. And also there are native ideas about women who use family planning methods. The level of schooling among indigenous population, especially relation to women, is less than in non-indigenous women. And we know that the educational level is directly associated to the use of modern contraceptive, modern family planning methods. On the other hand, as regards the supply, the fact that the health services are very far, and the cost that mobilization implies leads to less use, and they do not go to get the supply or resupply the methods, and sometimes they are stigmatized by other people, especially men. And besides, the lack of information in maternal language is something that limits the demand, since in this in the supply. The advising is very important for free election and informed election in order to have continuity and to decrease the abandonment, and also to have a correct use, and also the advice has to be in the mother tongue, but that capacity is not always there in all the services. In the most basic primary services, there is a limited of supply of methods, and the different process is sometimes difficult. Since 2014, when the central government stopped hiring a network of non-NGO that gave services at community level with suppliers of health services, 6 million inhabitants did not have adequate access to health services, and most of them are the Mayan population, and also health personnel it does not fully know the real needs of the population, and there is limited coordination and efforts that let us have a better coverage. COVID-19 pandemics had also affected the family planning services and maternal health services, and probably the gaps have increased in the last 2 years, and also there is a deterioration of maternal health, especially among indigenous population. As a consequence, we have many challenges to recover the gaps I mentioned, which have been worsened by the pandemic, and we need to decrease the little youth. We have to reestablish a primary health service that would that would put all the services close to the population, especially the Mayan population who had been left behind. Thank you very much. Thank you very much for the
helping us understand these differences between the lesser access of indigenous women and non-indigenous women. Now, I would like to thank Marta Julia for her participation, and I would like to ask her to share with us how do the subcommittees help address discrepancies in family planning access and use between indigenous and non-indigenous populations? I will change my question a little bit to address to Dr. Karen Morales. Sorry. Dr. Morales, would you be so kind to share with us, with your great experience, which is the impact of the CNAA and subcommittees in terms of increasing accessibility to an update of modern contraceptives? Dr. Morales, thank you very much. Good morning, everyone. Thank you very much for allowing me to participate in this discussion. I believe the first thing to define is that the Commission itself is an organization that consolidates the most important institutions in the country that deal with family planning. So, at a central level, the Commission itself organizes the institutions, it gathers them, and coordinates. She's muted now. She's muted. I cannot hear her. Armenia is muted. She is muted now.
Una actividad.
An activity. And I believe this has been an important situation that all the institutions within the CNA have dealt with. It's also important the fact that This cost-effective strategy may have a very positive impact in the reduction of maternal deaths and neonatal deaths, which is one of the main objectives of the Ministry of Health through this reproductive health program. And locally, the department subcommittees of the National Contraceptive Security Commission, they have been working for a few years, and others are quite new, but they have noticed in the different meetings that they have locally that they strengthen this integration between the different institutions, and they integrate the services within the Ministry of Health. This situation allows us to position family planning and to have data available and analyze the data so that the solutions in front of these problems may be realized and applied in the place where they find the problem. The topic of promotion has been a very important topic in the subcommittees because each area has their own promotion methods that are more important locally, but these social networks have been very useful for these subcommittees to promote family planning, regular family planning, and special meetings that they may have locally. I can also mention that group work and being able to visualize the difficulties in terms of the supply and distribution of contraceptives, and the relationship of the logistics, local logistics, has been very important because before the subcommittees, it was hard to find the link between these areas. And I would also like to mention that since 2019, we have had a strategy focused on having the supply of contraceptives in the hospitals. Before this, it was very weak, and with this strategy, we have improved the access to contraceptives at the time of post-obstetric time, and the subjects involved in working in the hospitals are integrated into subcommittees, and this link, this relationship, has formed a demand that did not exist before. We still have challenges, but I believe these were the main advances that we have had in the subcommittees, and the fact that we have had we are forming more and more subcommittees, we are having better results in the terms of family planning.
Oportunidad para todos escucharla, valorar la importancia que tiene la permanencia de los actores en las instituciones del Estado como el Ministerio, como es su caso, para ir avanzando sobre los logros, la participación de la cooperación internacional.
The cooperation and the presence of actors who remain at the level of the departments, as is the case of Salvador, who is going to share with us the experience at the level of the different departments. Dr. Karen at central level, and Salvador, that is in the Quiche department district, which is highly significant there to break all the barriers that limit access to family planning, a department where there is a high percentage of indigenous population. Salvador, what we saw in the video, we realized that they talk about the impact of the CNNA and the subcommittees have had. You being an actor in an area that coordinates with different people, I would like to know how have these institutions, the CNA and the subcommittees, contributed to family planning and other health goals in the area of Quiche? Salvador, you have the floor. Good morning, everybody. It's really a pleasure to be able to share this opportunity with you for us through all the different meetings of the CNA. We have had a great experience, and the creation of the different subcommittees, the interinstitutional relations have been strengthened, and we have worked together, and we can discuss and analyze the different situations and the different topics related to family planning. We identify gaps, advances related to promotion, access, and availability of contraceptive in all service centers. We have analyzed not only the permanent centers, but also up to the first level in the different health posts that we have in small centers we have, and the and also the merging we had with different institutions has been strengthened. The scope of the services, and we can see the conditions of supplying a service, and we can promote access also. Together we try to find strategies to reduce gaps and to strengthen successful actions, and we have different meetings where the different institutions participate, are involved trying to find a solution from the different points of view. So it has been really successful, and we have been able to work and together with the other institutions, and we have seen that if we are together, our scope can be broadened in our desires. What we wish to. Thank you, Salvador. You show us the significance.
Tanto la CNA como
to know how the CNA has been conceived as where we have several government and civil society actors that integrate their efforts so as to have a better access to family planning. Now, in relationship with the subcommittees, I would like to listen to someone who's very experienced in this long process, and I would like to ask Dr. Ruiz, how do the subcommittees help deal with the discrepancies in access to family planning between Indigenous and non-Indigenous people? Dr. Ruiz. Thank you very much. Good morning, everyone. It's a pleasure to share with you this meeting. And I believe that in line with Salvador, what Salvador was saying, the access and analysis of information is the first step. And this is one of the activities that the subcommittees carry on permanently. And we know that in order to provide an answer to a problem, we need to recognize it and realize the size of the problem so as to have a framework and define local and contextualized strategies as regards the demand and the supply. So the results of this analysis are aimed at providing information on the continuity of family planning services within the current context during this pandemic situation. So I believe it is part of the work of the subcommittees to invest and to promote the investment on those who have lesser access to contraceptive methods, and so as to guarantee equity and the right, and to guarantee the supply of contraceptives in all services, and together with that, the competence and sensitiveness of the providers, service providers, because they need to guarantee that all the norms, the standards are met. It's important to for the users' satisfaction, of course, and to the promotion of services. So everything that the subcommittees are doing, this is the richness of this organization or organizations locally.
Comisión y los subcomités funcionen, debe haber procesos de fortalecimiento de capacidades para desarrollar una metodología de trabajo que se vuelva una herramienta de abordaje no se dan por casualidad los resultados, sino hay un proceso de integración de datos, de fortalecimiento
of data, strengthening of capacity, and use of tools that makes the work of the CNA possible and the committees. And we are not saying with all of this that everything is a success, that we have solved the problem already. So I would like to return to Dr. Morales so that she can share with us from her experience, from working on this area and recognizing that she is a person that is fully involved in the work related to family planning. Could you share with us the challenges we have ahead to increase access to family planning and to implement subcommittees across the country? Thank you very much. Yes, I believe that this challenge, as everything, is continuous. We have seen different changes that are highly significant today with the pandemics, for example, and we know that what we have done and we probably have advanced, and sometimes we have some negative situations that are temporary or continuous threats. And this situation has been seen in different occasions. So many of the challenges that I will mention are things where we have advanced, then we have gone back, and then we have tried to find a different one, but it's a constant work at the different levels. And one of these is precisely the topic of access for vulnerable populations. Although there is an increase of family planning in the country as a whole, we do know that there are different populations that have less opportunities to use contraceptive methods. And we know that vulnerable population are concentrated in the indigenous poor populations and also among adolescents. I believe that the work with adolescents is something that we still have to improve. It's a situation we need to advance, and we are working in order to improve the situation of the adolescents and to widen the mechanism for the acquisition of contraceptive methods. Guatemala, we have only one mechanism, and we need to explore new ways and establish links so that we have contraceptive methods and we have access to better technologies. The fact of registering family planning is a weakness. They register not only at the level of family planning, also for health. And I believe it's something we have to improve to make decisions that are timely decisions. It's something we can improve and also reduce the care barriers. Although there is a lot of spreading of the information, there are still barriers at local level. In the service providers, sometimes they are not just related to one sector, it's at the level, at national level, that we have to reduce these barriers. And among the health services, there is a high turnover of personnel, of staff, and many of the processes as a result have to be made continuously in order to improve access for population. So at the beginning of the pandemic, and this is a challenge we are adding because the pandemic also reduced the service hours, and some service centers have been closed or open, and this is a situation where we have to make improvements so that there is family planning becomes a priority. It's an emergency because we have a non-planned pregnancy. And thank you very much. And I thought how we moved at the beginning of the pandemic.
para tomar decisiones.
In all the activities so as to make decisions how to deal with each of the topics, and in relationship with one of the pillars of the World Health Organization, which has to do with the continuity of the services that very quickly, thanks to this organization that we have in the country, we were able to act quickly so as to look for the activation of the supply and demand of family planning services. We are receiving questions from the audience, and we invite you to make questions, 2 questions that I would like to please make them I will make 2 specific questions. First to Dr. Ruiz, how can the CNA and subcommittees to recover the supply and demand despite of the efforts that have been made to recover? We need to recover even more the supply and demand, the family planning services, specifically because they were reduced because of the pandemic. Dr. Ruiz, you have 1 minute. As we know, CNA and the subcommittees have their basis in family planning services, Decree 87/2005. This provides sustainability to the articulation and follow-up of working sections that we have been talking about. And you know that the government reduced access to people, especially to women, to family planning services and other services as well, because of all the reasons that we know. And this is why during the pandemic, CNA and the subcommittees have become spaces to share information and then analysis of information, analyze the context and provide responses. And these are actions that need to continue. But at the same time, they have also added to their everyday work new topics that have to do with logistics or transport, for example, of contraceptives, shipments, cost increase, the low production of contraceptive worldwide that you all know, that has been a common problem in the year 2021, or between 2020 and 2021. And so we have to think about them for the future. And this also leads us to the fact that we have to think about innovating strategies, changes in the paradigm so as to guarantee access to contraceptives, to services that are in remote areas. Like this is the main goal. And of course, some other aspects like the increase in the supply of long-lasting methods in certain communities, like that somehow has been done, but we need to strengthen it, these strategies, because due to the pandemic, the situation changed, as we said before, and we have to analyze this part of the demand. Women need to have options so as to have access to what they need. Thank you, Doctor.
Y centrarnos en las preguntas. ¿Yo? Pues.
We are going now. We're going to go to Dr. Morales, and we will ask her to answer the question of Olivia Cáceres. She asks, in rural communities, in indigenous and non-indigenous communities, religion has promoted family planning, especially contraceptive, something that cannot be done. How are you going to handle? In Guatemala, the legal framework typifies abortion as a crime. Is a crime, so we are not promoting abortion here as a way of contraceptive method. So contraceptive method is not hand in hand with abortion. Marta Julia. America Rodriguez makes the next question. Do you consider promotion of access to family planning service with community leaders, for example, COCOLES? Marta Julia, yes. Yes, with the community leaders and with other groups at community levels, we have had different health, we have had socialization of the legal framework as relation to reproductive health. This is important because the religious leaders and community leaders, they want to have that evidence, which is the legal framework. They want to have it, and also we socialize it from the point of view of the family as a strategy to avoid maternal death and also to approach malnutrition or undernourishment. So we are handling it from different points of view, material that has been drafted especially for the different populations. Marta Julia, and I'm asking, which are the challenges?
La población
Challenges in bringing family planning services to the young population. Which are the challenges for family planning to take family planning to this important group? I believe that mainly promotion is important and information is important. Young people have a lot of access to information, but they need information to be based on scientific evidence. And of course, it needs to be available. They need to know where to find it, where to find the services and family planning services. And in this perspective, part of the work that we are doing in the Ministry of Health is the promotion of friendly environment and differentiated services. These services need to work now, right now in times of pandemic, according to the standards, to the normatives, regulations. Dr. Karen, from the audience, Marina Gomez is asking, how does CNA incidence in the curriculum of the training of healthcare providers training to consider family planning to contribute as one of the goals to reduce neonatal maternal death? Yes, the committee is a committee organized that has been organized several years ago, and they have tried to work on this topic. And there is a line to work in this topic. Every 4 years, we update the strategies so as to make decisions in topics that we consider important for family planning to carry on. And right now, there is an axis that we are working on this link. Despite of the efforts, we have enabled some situations within the universities, especially within the universities, so that the student population in terms of healthcare, they can have this training and that they can so that it becomes a strength when they come to work. And in this training axis of teachers and professionals, is that important to consider topics like this? Absolutely. It's important. Teaching is important. It's in charge of the Ministry of Education. And I believe they have the training, but probably it's not so deep. So there are certain situations that make the teacher to give their own experience according to their own experiences, what they have lived and what they have seen in their family, in their community. And sometimes this can be a barrier in the process. So it's important so as to have a mid-level and at the level of teaching courses to have this training so as to provide this sexual education, sex education, that is so important for youngsters to come closer to healthcare services.
Este panel. Y pregunta, ¿están avanzando en el uso de la telemedicina? Por lo menos para ayudar en consultas cuando las usuarias tienen preguntas o quieren empezar un método, pero tienen miedo.
Sí, creo que este asunto de la telemedicina fue una situación un poco forzada que se empezó a trabajar durante el tema de la pandemia.
In the pandemic, definitely we had to use different mechanisms so that the users continue using contraceptive methods. So we had started to work in telemedicine, especially as regards counseling. We had different meetings, and the counseling was given through the phone in our case. And with this, the different users could come to us. We could give them an appointment and to have less distance between the consultation. So these were significant changes, especially in counseling. We had different teams that were in charge of training, also on the use of mobile phones, which are the type of devices that have professional, and the personnel that was in charge of family planning that was sent to other to COVID health care. So they continue to give information as regards to reproductive health. Mar is very active, and she says now, I also would like to know if there is an increase of planning after birth. Which are the strategies that the ministry applies as regards this after birth? I'm saying what we have because eventually was something that we had to do. It was part of the standards, but we have to see the positive and negative aspects of pandemic. A positive aspect was that at the hospital level, there was a promotion of contraception. So we have different contraceptive methods that may be used in the postpartum and after an abortion, if there was an abortion, and we are sending those data, and we have seen an increase in family planning. Marta Julia. And in order to answer Marina Gomez, can you give us, how does the CNA contribute to keep the supply of all the different contraceptive methods? Marta Julia, as I mentioned before, at the level of the CNA, we analyze the information. The Ministry of Health, in this case, submits the information as regards supply, and there is a surveillance in this case. We try to see the availability of the method, but as I mentioned before, we also make sure that there is acquisition of different methods. It's part of the functions of the CNA, and at local level, the different subcommittees monitor everything and discuss the information with at the level of the subcommittees. And as we saw, in those subcommittees, we have the participation of institutions like Ministry of Health and others. They can discuss and make a follow-up of that, so that there is a supply, a constant supply, which influences in meeting the needs of the users. They have the right to have the methods when they require it and the one they choose, which is the goal. Thank you.
Clarifying, and I believe it's important to share the work that the CNA and the subcommittees are doing in terms of requesting to the clarifying accounts for the finance ministry that needs to present and translate to the Ministry of Health for these reproductive health care services. Family planning is important, and then for it's necessary to provide show the figures so that they can account for how they are using the resources. I believe it's important that so as to show the obligations according to law and that contribute to the Security Commission. And the same happens for the subcommittees where the areas commissions can show their accounts and analyze which are the differences between the territories and where we should have more focus in one of the topics. Now, Sarah Chick, she's saying, thank you very much, Sarah. She's mentioning, she's saying, congratulations, everyone. I would like to know if you have any actions, if you have thought about any actions for rural vulnerable populations where they don't even have a healthcare facility or a friendly facility for teenagers and youngsters. Well, the Ministry of Health also forms alliances with other organizations in family planning services. And one of these organizations is the Integration of Contraceptive Committee, that is SAPRAFARM, which is the level of this institution, and other institutions celebrate agreements with the Ministry of Health so as to provide these communities with family planning services with mobile institutions that are right now, they are having some difficulties because of COVID, because they move around according to the traffic lights of COVID, but regularly we have done these agreements so as to provide family planning services to these areas. Right now, the service is working, and they are not working probably in a stable way because it depends on the number of cases, COVID cases. But and the other thing is that within the healthcare areas, there are personnel who visit the different territories, and they go to the houses, and this allows these personnel to take the short-term contraceptives to the users they are taking care of, and they provide information and counseling so that they can have access to a family planning method. Thank you very much for your concrete answers. And the last question from Jacqueline: how does the CNA may contribute that everybody involved in providing contraceptives to have the minimum range, because there are some institutions where this range of methods is very low. For example, only 1 or 2 contraceptive methods are provided and are efficient. Well, within the organizations that form the commission, we have tried to make joint purchases so as to have a wider range of contraceptive methods. But there are special situations of each institution that may make this possibility not so available. And there are some regulations of different institutions that may make it impossible for women to have an IUD, or these are situations that have to do with internal regulations of each institution, but the link of the CNA and promotes the identification of these barriers and to work so as to overcome these barriers and have access to these contraceptives within these institutions. We still have a lot of work to do, not because we have not seen it or identified it, but because we need to do political work within each institution. Thank you very much, Doctor. I would like to close this panel by thanking for the HE Plus to all the panelists, all the officers of the civil society, the International Conference, USAID, and for their collaboration for the advances of family planning services in Guatemala. And Emma, I would like to know if you would like to add something.
Gracias, Herminia, y gracias a todos. Muy rica todo el intercambio de esta mañana. La verdad que a nosotros como Oficina de Salud y Educación en la
As an office, we are really pleased to listen to the evolution that the idea we had a long time ago had when we started the discussion about the significance of having a commission like the one we had, the involvement of the reproductive health department, how everything let us somehow advance, and we had the support of the population of the United States that has supported this advancement, this development that represents a replication at local level. We have a central committee and then subcommittees which are significant for us. We are very pleased to see the evolution and to learn about all the experiences, and we hope this will be expanded. We hope that we will go to the different parts of the country. Now we are focusing some priority areas, but we need to extend it to the whole country. We hope this experience will help also to other countries, not just to our country. Thank you and congratulations. Thank you. And we close the panel, and Jay, you have the floor now.
As we saw in the video and heard from our panelists, policy work is broad, going far beyond the development of a specific policy. Policy implementation, the act of translating the words in a policy document into
en acciones y servicios y lo que hemos visto hoy es
critical role in achieving policy impact. I want to thank Herminia and our panelists for their insights on the advances, the challenges, in spite of everything that's been going on with COVID-19 in the past couple of years. This presentation of this video is the start of HEP Plus's final dissemination events. What we've seen today is one of the many amazing things that have been accomplished through this project. Links to the video in English and Spanish will be sent to all registered attendees. Again, we thank USAID for their support over the years, and to each of you for making time to join us today. On behalf of HPP Plus, I wish you a healthy and productive day. Thank you.